Tonight on Recruits.
1, 2, 3.
John's first car crash.
We've got oxygen on him. How's his colour looking now, John?
How are you feeling, Alan?
Rebecca attends a tricky domestic situation.
She must have really given him a good old heap to get him out of bed.
And Jenna's worst fear.
It's something I'll never forget. I've never felt like that before.
I'm addicted to this universal feeling called life.
Patient injured in traffic accident, male of unknown age.
Trainee paramedic John Williams has been in his dream job for just 2 weeks.
The reason I wanted to become a paramedic was because I wanted to be able to go to work and come home at the end of the day knowing I've achieved something worthwhile.
Tonight, he's on his way to his first car crash.
Trapped victim, car into power pole. Electric hazards are involved.
John's mentor is Jordan. After 3 years as a paramedic, he's witnessed more suffering than most see in a lifetime.
We were all that brand new person that came through the door and that was terrified about what we're about to see and the pressure that was upon us.
Consciousness and breathing unknown.
Oh, so this is a big job if he's unconscious.
Paramedics attend 12,000 car crashes a year across Australia. But trainee John has little idea what to expect.
Really need to talk me through this, mate.
Yeah, you're right, mate. You're right. It's totally fine.
John and Jordan wear hard hats as a precaution against falling power lines or unstable walls.
Go get the collars bag now from the boot of the car. Get the stretcher, bring the stretcher right here and a spine board.
So it's the first time I'd been at a scene like that, and just with the police and fire brigade and then another 1 or 2 crews on scene as well. There's so much going on.
What was your name, sir? Dermot. My name's Jordan. My partner's John. It's a 67-year-old gentleman who has been driving home and says he began to feel quite drowsy and tired. It seems like he's veered off the road and driven into a wall. So what we need to do is protect his neck, get him out of the car as quickly as possible and get him up to Royal Prince Alfred Hospital. John, go around the other side.
Yeah, rescue. Can we stay well at the back of the car? So can we just jock it, please?
Hang on 1 second. Obviously, we have to be wary of the danger to us. There's power lines down, the car is potentially unstable or could still move, especially in the case where it's on a slope like that. There's things like risk of explosion and chemicals and things like that. So, John, put your goggles on, mate, or put some safety glasses on.
Special caution is taken in case Dermot has suffered a spinal injury.
John, my partner is stabilising your neck. So, Dermot, a most uncomfortable collar on your neck for a moment now.
Dermot's heart rate and blood pressure are low. It's crucial the team get him to hospital.
Dermot, we'll lie you flat and we'll pop a board underneath you and then we'll get you onto our bed.
Okay, yeah. On 3. 1, 2, 3. Yeah, he's on. Am I able to lift his head to put it underneath or like...
Have you done it like this before?
No.
Kind of twisted it a little bit. And then the other one you put around there.
Oh, okay. Yeah, I get it, yeah.
For John, the lessons from college have taken on practical importance.
I need to take a blood pressure on your arm, Dermot.
When we got him in the back of the ambulance, as soon as the door shut, I think my heart rate just went completely down. I really started to get my head back together, but yeah.
So let's get a blood pressure and get a line into him, please. We've got oxygen on him. How's his colour looking now, John?
Yeah, it's coming up pretty well.
He was still pretty pale sitting up. Is his colour improved?
Yeah.
Okay, all right. So
But the lessons are far from over.
At the moment, the gentleman's heart rate is quite low, and that's quite unusual for someone who's been in a car accident. He may have had some incident with his heart, which may have contributed to why he crashed today.
Starting any new career is a challenge, but for trainee paramedics, making mistakes can cost lives.
He's got lots of stuff going on. It moves pretty quickly.
Yeah. So as soon as we got in the ambulance and closed the door, it was a lot better.
The more time John spends doing stuff on road, the more assured he will feel about his own ability. You can't beat experience in this job.
Dermot spent 2 weeks in hospital, having suffered multiple injuries. Back at paramedic college, 50 new students are just 2 weeks into their new careers.
They've come from a variety of backgrounds. we're not really interested in where they've come from. What we're interested in is being able to shape them and get their mind ready for what they're going to encounter out in the road.
Today, they've reached one of the most anticipated days of the entire course.
It's better than Christmas.
I see my helmet.
One hat. Oh, it's a floppy hat. Ugh, yuck.
But for students, the blue uniform must be cautiously used.
You are able to wear your uniform to and from home. The only problem is if something happens and the general public see you, what are they going to say? Help. And you're going to say, I've only done 2 weeks.
There are also other restrictions on appearance.
You're only allowed to wear 1 earring, and it is to be a stud. OK, a stud.
Former bookseller Danielle Stroinek's oversized ear piercings are a problem, but she has a lot more on display.
There's a certain stigma attached with tattoos. When I walk down the street, people don't automatically see me as someone they can trust, but hopefully they will notice the uniform before they really pay attention to what I look like.
The tattoos can stay, but the piercings must go.
They don't want to come out.
Monday morning, and Danielle is taking on a whole new look.
Today's our first day we get to wear our uniforms, so we're actually going to look the part now.
Former fireman Rayner is used to uniforms, but this is the one he's always wanted.
We're part of the team now, just a little bit more. We're working our way. We're getting there, we're progressing. It's good to see that, we're getting somewhere.
Now they've suited up, there's a basic lesson. Getting a stretcher into the ambulance.
Push down, pull up.
Down, up. Yeah, that's it. Nice and strong with that. Oh, no, not that way. Not that way. No.
Incorrect use of a stretcher can injure patients and paramedics themselves.
Definitely making mistakes is where I'm learning the most. I'm not consciously trying to make a lot of them, but it's happening. Yeah.
Out on the road, trainee Rebecca and mentor Matt respond to a 000 call. It's a world away from her life on the Central Coast as a mother of 2.
I'll see you tomorrow when you finish school. Bye. Bye-bye.
From the moment she put on her uniform, she's revelled in being a paramedic.
The first 3 days on road, I got exactly what I wanted, which was to make a difference in people's lives when, they need us the most.
Every week in New South Wales, paramedics are called to over 100 drug overdoses. Rebecca is about to attend her first.
He's about 25 years old. He's very, very drug affected.
Hello, mate. Daniel. What's your name, mate? What's his name? Daniel. Yeah, Daniel. Oh, yeah. Daniel, what's going on tonight, mate?
The two friends had been out clubbing.
Let's get these guys to assist you, please.
Wow, what's he taking tonight, guys?
I'm really not sure because I haven't seen him.
Okay, don't worry about the police here, but what's he taking tonight?
No, they asked me and I would really assist them if I know. I really would because I really want to get him help.
Okay, where's he been?
Being my first drug overdose, I was just absolutely gobsmacked to see him in that kind of state.
And I can't really get him to talk to me or...
Rebecca and Matt have been called to a drug overdose in the city. But it's unclear exactly what he's taken.
Has he had cocaine tonight?
I'm not sure.
You're not sure?
I would definitely tell you. I would
ecstasy or something like that?
I really don't know exactly what. He obviously did take something.
Has he had alcohol as well tonight?
We had probably.
We're going to get to bed. We're going to get to bed. We're going to put him straight on the bed.
Okay.
With nothing to go on, paramedics can do little more than get him safely to hospital.
So he was just an absolute mess, couldn't talk to us, all he kept doing was blowing raspberries at us. It was like dealing with, like a tiny little baby that didn't know how to talk because we couldn't get any sense out of him whatsoever.
See, he's got this repetitive lip smacking. Yep. And he's got this sort of twitch happening in his eye.
Daniel, keep your legs on the stretcher.
Rebecca and Matt need to get the man to hospital quickly and keep on their toes.
Daniel, what's going on tonight? Sit down, sit down. What's going on, Daniel? What drugs have you taken tonight?
Nothing.
Don't lie to me. What are you in this kind of state for?
No.
Are you lying?
Yeah.
Daniel, I'm just going to put some oxygen on, OK?
Lay down, Daniel.
The man is becoming increasingly nauseous.
Here.
Daniel. Here. No, Daniel, hold the bag for me. Okay, lay back down.
When you see the facial expressions or the involuntary movement of eyes and, you know, the different noises that he was making with his mouth and the bolting upright, it just makes you wonder exactly what's going on, you know, what these drugs are doing to your brain. We're taking him to the hospital and we just don't know what he's taking, so we've just got to hurry up and get him to hospital.
How much have you had to drink tonight? Legs on the...
Daniel, keep your legs on the bed.
The man will undergo blood tests, while the drip will dilute whatever drugs are in his system.
When you shut the back doors and we're walking around to the front, you did the whole goose step over the big trail of vomit coming out of the back.
This is the glamorous side of being a paramedic. He's cleaning up after drug-affected, alcohol-affected people vomit in the ambulance, straight through the back doors of the ambulance, over the sheets, and whatever we could catch.
Back at college, paramedic chaplain Ray Green prepares students for another grim reality of the job.
You will be confronted with death and dying in all its manifestations. Some of that death will be as a result of trauma, some of that death will be in homes, and then you're going to have people who die as a result of major trauma of a motor vehicle accident where you'll be picking up body parts around the place. You need to be aware of it, you need to know about it.
The biggest fear that I have on the job is dealing with dead children. I have no idea how I'm going to deal with that.
So in class, it's one thing. Then when you go out there, that's it. That's the real deal.
Out on the road, Jenna is about to face the real deal for the first time.
So you found somebody laying on the floor, did you? No, not on the bed. Is she conscious? No, she's dead. She's dead. Dead body, you know.
You can practice all you like, but until you get there and get those smells and scenes and sights and whatever, you don't actually learn it.
The patient is already deceased. We still have to go in and check, pretty much. So we'll see how it goes.
Hello. What's happening,
A
mate?
concerned neighbour in the Housing Commission flats made the call to 000.
You saw her before Christmas? Has anyone else seen her since Christmas?
When I was about to go in, I was a little bit apprehensive at first. I was kind of thinking, oh my gosh, there's a deceased person in there. I've never seen a dead body before. It's a little bit scary.
I don't know, was like that.
The woman was last seen alive 12 days ago.
That's it, right.
The first thing that got me was the smell. You can't even describe it.
Sorry, darling, I had to...
It's something I'll never forget. I'll never forget that smell. I think once I smelled it once, that's it.
Confirmed code 4, police required.
I've never felt like that before. I think it's just the smell just really got to me, and once I kind of, recharged and had a bit of a step away for a second, I was able to go in and check the patient.
Jenna has no choice but to back up her partner Cleone.
You got it? Yeah. I just heard it for a minute.
In Sydney's West, Cleone and trainee paramedic Jenna have made a grim discovery. The woman is beyond help, but an experienced eye offers clues about her death.
Jenna? Yes?
335, copy that.
I'm sorry. She's got an asthma puffer in her hand, so she may have been having breathing problems and using a puffer. Like Respirest.
It was a bit sad, actually. She had Christmas presents wrapped up under the tree. It's also sad to think that she may have been there and no one's noticed that she was gone.
I think that's the thing that really hit me the most.
What happens from here now, darling, is she's passed away and it's an unexpected death.
Yeah.
So the police are informed and they'll come here.
Yeah, no problem.
Okay. So you saw her before Christmas?
I met her Merry Christmas. I was
Yeah,
going to
okay.
Canberra.
Okay. Do you know if anyone else may have seen her between Christmas and when you've seen
Some
her
lady
today?
was clean up, but I don't know.
The patient's obviously deceased. She's on her bed, so it appears that she's gone peacefully. She's quite bloated, which is part of a natural process of a patient dying, and she is starting to decompose. So there's an odour coming from the unit that she's in.
It's pretty confronting. I mean, I haven't really seen a deceased person before that has probably been deceased for I don't know how long.
Only 2 weeks on the road, and this is one case Jenna will never forget.
It is part of the learning curve. Yeah.
Across Sydney, 2 a.m. Trainee Rebecca and mentor Matt have been called to an apartment. A man has been injured in a fall.
What happened tonight, darling?
Oh, he was laying there and he must have been dreaming or something.
Right.
And I accidentally pushed him over too far. And
You pushed him off the bed?
Yeah.
You pushed him out of bed, did you? On purpose?
He was nearly pushing me out.
That's no good, is it?
How are you feeling, Alan?
Not bad.
You feeling okay?
Yeah.
Because you're sweaty, but you're also cold.
Do you know what day it is today? He's quite confused. All right, Alan, we're going to try and stand you up, okay? You ready? 1, 2, 3. Up, 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 and on the bed. That's it. Is that a bit better? Whereabouts do you live, Alan?
Waterloo.
All right, and what year are we in at the moment? Alan, what year is it? Alan?
2010.
Okay. Let's just get a beep on him and we'll check a few things and
2011.
see what happens. We'll check his obs.
The question for Rebecca and Matt is whether Alan's confusion has been caused by the fall or something else.
Do you have any pain anywhere?
Whilst he, could tell us that he wasn't hurt, he was confused, which sort of threw signs to us that there's something else was going on here as opposed to just a fall out of bed.
Have you got any pain in your chest, Alan?
Coming up, Alan faces the music.
You take too many damn tablets before you go to bloody bed, mate.
Just take some big deep breaths for me, Alan. And out.
After being pushed out of bed by his wife, Alan is disoriented and confused.
Any pain in your back?
No.
What about down here on your neck?
No.
No? What about down here?
But trainee Beck suspects the fall may not be the cause of his problems.
Alan, have you got any history of diabetes?
Yes.
Yeah. So you're diabetic?
Yep.
Insulin dependent?
Yep.
Beck has solved the mystery. Alan's blood sugar is dangerously low.
We're going to fix that up for you now. Alan, just open your mouth up. Have you had this stuff before? Glucose gel? Open your mouth up for us. There's going to be some sugar. Okay, swallow it all down for us, mate. Not real nice, is it? So just squeeze it all up.
Whenever you arrive to a job, the first thing that kicks in is the training that you've been put through. All you're thinking about is trying to find a reason for why you're there, why the patient, has needed an ambulance. You don't think about what the patient's wearing, what they smell like, or anything like that. It's just, you're just concentrating on treating.
Are you feeling better than when we first got here?
Yeah.
Okay. All right. Do you reckon we could take you out to the lounge room and you could have some food to eat for us?
Yeah.
You want to just sit just here, Alan?
What was your name, darling?
June.
June. Okay, my name's Matt. What's happened today is Alan's blood sugar's too low because he's a diabetic.
Yeah.
He had his insulin tonight and he didn't eat. It's not real good, is it? Careful with the knife.
Why didn't you have something to eat?
Because it's 2:10 in the morning.
You take too many damn tablets before you go to bloody bed, mate. So you're right, you got pushed out.
I really didn't expect the wife to sort of be nagging at him so quick, but she was straight in there. So I think she's gone from being really anxious and worried about her husband to you know, okay, yep, he's now talking, I can now attack him.
I couldn't get no bed to sleep on. He kept pushing me. I tried to wake him up. Oh, God. I pushed him too far and he went down head first.
How you feeling?
Next trip, the ambulance will take you.
And are you allergic to anything?
Only her.
You be nice, Alan. If you're worried about him at all, June, just give us a call back. You right, Alan?
Yeah.
Thanks very much.
Thanks, mate. You look after yourself, eh?
Don't take any more damn sleepers, please.
Oh, you're welcome. The husband and wife team were a bit comical. Then I just loved the whole, he pushed me, she pushed me out of bed. That was just so, how'd you fall here? My wife pushed me out of bed. I mean, when you looked at the wife and you looked at our patient, it was just like, she must have really given him a good old heave to get him out of bed.
You call us if you have any dramas, okay? All right, lock the door, June.
Yeah, I will.
Okay.
Thank you.
Thank you.
Bye-bye.
Next time on Recruits,
I like what I see.
the fallout of a city brawl.
Breathe with me, okay? In.
A tricky diagnosis.
What's wrong with me?
That's what we're trying to work out.
Don't treat me like a jack.
And an even trickier patient.
The conversation is finished.
It's all right, it's all right.
And for more Recruits action, log on to the website.